Hello, this is Dr. Sakarya. Today I'm going to talk about brachial plexus injury and its treatment. Just imagine losing the ability of movement of whole arm after a motorcycle accident. This is what happens after a brachial plexus injury. It's not always permanent. It might be temporary, but still we have a lot of reconstructive options. Brachial plexus is the network of nerves located in the neck. The nerves that are responsible for the movement of the whole arm, forearm, and hand. These network of nerves are stretched or ruptured after a motorcycle accident or birth injuries, and generally due to the stretch in the neck area. After the physical exam and some studies, if you believe that the nerves are ruptured instead of stretched, then there are some reconstructive surgery options. These include muscle transplant, nerve transfers, and sometimes tendon transfers depending on the location of the nerve damage or the extent of the nerve damage, and sometimes the duration of the nerve palsy. If the injury occurred in less than 6 months, sometimes we can wait up to 1 year in some certain conditions, then we may suggest some nerve transfers and nerve repair surgeries. But if it's more than 6 months or 1 year, then we generally tend to perform muscle transplant for the muscle movements. However, obstetric brachial palsy needs different approach. In these cases, generally the muscles are intact, but they work inappropriately or unbalanced. For these children, we generally do tendon transfers or sometimes muscle release to improve the muscle movements. After a partial brachial plexus injury in an acute onset, our expectation is very high. Sometimes we can achieve a complete recovery. However, in patients with complete brachial plexus injury, a avulsion injury, we generally cannot get a full recovery. However, still we achieve an M4 power, meaning that ability to flex the elbow joint completely after this type of injury. And here the most difficult part is the hand reconstruction. Because the nerves are so far away from the hands after this type of injury, hand reconstruction is generally very limited after a complete brachial plexus injury. But still, we can have some improvements in the hand, for example, grasping power and sensation. And in recent years, for hand reconstruction after a complete brachial plexus injury, robotic devices are used more commonly. And physiotherapy is another very important point after the treatments. It's very crucial for the brain to adapt the new nerve pathways and nerve transfers and to strengthen the atrophied muscles. Now I'd like to tell you about a story of one of my patients. This little boy had a traffic accident at age of 2 and a complete brachial plexus palsy, and I had to do a muscle transplant from thigh to the shoulder so that he can flex his elbow, which is one of the main function in the hands and in the arm. And after muscle transplant, he can easily flex his elbow joint, so he can flex his hand to his mouth, and now he has sensation in the hand after such a dramatic accident.
Brachial plexus injuries cannot be treated.
No, brachial plexus injuries are treatable. However, there are some good prognostic factors. For example, if the onset is acute, less than 6 months, if the patient is younger than 50 years old, if the injury is partial, then we can get much better results. However, it doesn't mean that we cannot treat otherwise. Still, treatments is possible, but the only thing is the rate of recovery is less. However, still it's possible even after these conditions.
If the function doesn't return in 3 months, nothing can be done.
No, it's false. First of all, we can wait up until 6 months in some certain conditions, but we know that the sooner the better for the end results. And for patients who come late to us, let's say 1, 2, 3 years after the injury, still muscle transplant is an option, and we can get a very good elbow flexion result. I'm a plastic reconstructive and aesthetic surgeon specialized in reconstructive microsurgery and peripheral nerve surgery, including head and neck reconstruction and nerve surgery. Brachial plexus is located in the neck, and it's a part of head and neck reconstruction and peripheral nerve surgery. I completed my fellowship in Taiwan under Fu Chanwei and David Chuang, who are one of the pioneers in this head and neck reconstruction and peripheral nerve surgery and brachial plexus injury fields. And I have been doing reconstructive microsurgery surgery more than 10 years. Brachial plexus is a mixed injury, and I'm mostly responsible for the soft tissue reconstruction, including the nerve, muscle, and vessel repairs and reconstructions. When there is a need for bony reconstruction or ligament reconstruction, then I may seek help from my orthopedic friends. Brachial plexus injuries can be devastating, but we have a lot of options to help the patients to regain their independency and function. Please feel free to consult us your condition.